All right, let's jump right into week 29 of your pregnancy. This is a time when everything starts to feel incredibly real, not just for your baby's development, but for all the big decisions that are suddenly on your radar. So let's get into what's happening. Okay, so right off the bat, this week is a huge one. It's a real landmark moment because one of the most important things is happening. Your baby's lungs are taking a massive leap forward. Now, a baby born this week would definitely still need some help breathing, but their chances of thriving outside the womb just shot way, way up. It's a milestone that brings a whole lot of peace of mind. So beyond those amazing lungs, what else is going on in there? Let's take a closer look at all the incredible progress your baby's making this week. You know, the umbilical cord is literally your baby's lifeline, and it's a total marvel of engineering. Think about it. It's got two arteries to carry waste away from the baby and one vein to bring in all the good stuff, oxygen and nutrients. And the whole thing is packed in this protective stuff called Wharton's jelly, which is basically a built-in shock absorber. And get this, that cord can have up to 40 coils along its length. And that's not just for looks. This coiling, along with that protective jelly, is what keeps the cord from getting tangled or squished as your baby tumbles around in there. It's just a perfect design to make sure that lifeline stays wide open. And here's another amazing first for this week. Your baby's eyelids, which have been sealed shut this whole time, are now separating. For the very first time, they can actually open their eyes and see light. Their little facial features are also getting more defined. They're really starting to look like the person you're going to meet so soon. So you're probably feeling all sorts of kicks and jabs these days, right? But here's something you might not know. Just because they're moving doesn't mean they're awake. Their sleep-wake cycle is getting much more regular now, and a lot of those wiggles you feel are actually happening while your baby is fast asleep, probably dreaming. Okay, we've talked a lot about the baby, but of course, your body is navigating some major changes too. Let's shift gears and focus on you and some of the common things you might be experiencing here in the third trimester. Does this sound familiar? You're just going about your day and suddenly, bam, this sharp, shooting pain that starts in your lower back and zips down your butt and into your leg. What is that all about? Well, that unwelcome sensation is most likely sciatica. See, you've got this super long nerve, the sciatic nerve, that goes from your lower back all the way down. As your belly grows, your uterus can actually press on that nerve, causing that zinging pain. It's definitely not fun, but it is super common. The good news is you don't have to just suffer through it. Being mindful of your back is everything right now. A few small tweaks can make a world of difference. Always, always lift with your knees, not your waist. Use those strong leg muscles. And here's a great rule of thumb. If it's heavy, push it. Don't pull it. Seriously, your back will thank you. All right, let's tackle another classic third trimester annoyance. You finally get into bed. You're exhausted, you're ready to sleep, but your legs just will not cooperate. You get that weird, creepy-crawly feeling and this overwhelming urge to just kick and move them. Sound familiar? Yep, that's probably restless leg syndrome, or RLS, and it can be so frustrating. A few things can help. First, it's worth asking your doctor to check your iron levels. Then, really focus on your sleep setup. Make it cool, dark, and quiet. Try to put your phone away before bed. And here's a kind of weird trick that sometimes works. Distracting your brain with a puzzle or a book can actually help calm your legs down. So beyond all the physical stuff, your brain is probably starting to shift into full-on prep mode. As you're making all those lists, one of the first really big questions that usually pops up is the great diaper debate. So you've basically got two main camps. Disposables are, let's be honest, super convenient, especially in those chaotic early days. But the cost adds up, and they create a lot of landfill waste. Then you've got cloth diapers. They're way cheaper in the long run and can be softer on your baby's skin, but you have to be ready for a lot of laundry. It really just comes down to what works for your family, your budget, and your lifestyle. But hey, remember, this doesn't have to be an all-or-nothing decision. A lot of parents find that a mix-and-match approach is a sweet spot. Maybe you use cloth diapers when you're at home, but you keep a stash of disposables for when you're on the go or for overnight. It can really be the best of both worlds. And of course, diapers are just the tip of the iceberg. There are so many other important things to start thinking through. So let's zoom out and talk about planning for this whole new life, from money and work to how you'll feed your baby. Let's run through a quick checklist of some of the big conversations to start having right now. First, really understand your company's maternity leave policy. You don't want any surprises there. Then, sit down with your partner and have a real talk about your budget and how things might change. It's also a great time to start thinking about what work will look like down the road. And finally, if you think you'll need childcare, start looking now. Those wait lists can be wild.
Another big topic that's probably on your mind is feeding. We hear the word natural a lot when it comes to breastfeeding, but you know what? Natural does not always mean easy. It's a skill that both you and your baby have to learn together. The best thing you can do for yourself is to be proactive. Sign up for a class or just look up a local lactation consultant. Getting that support set up before the baby comes can save you so much stress later. All of this, the physical symptoms, the endless decisions, it can feel like a lot, especially when you're swimming in information from every direction. So for this last section, let's talk about how to manage all of that so you feel empowered, not just completely overwhelmed. This quote just hits home for so many people. It's that strange feeling when you start to feel like you've kind of disappeared and become the pregnant lady instead of just you. People stop asking how you're doing and only ask about the baby. If you feel that, I promise you are not alone. We live in an age where there is just too much information, and pregnancy can send you down some serious internet rabbit holes. If you find that all the reading is making you more anxious instead of more prepared, just give yourself permission to stop. Seriously. Women have been having babies for centuries without Google. Find one or two sources you trust, listen to your doctor, and let yourself tune out the rest of the noise. And that really brings us to the most important point of all. With all the advice and opinions coming at you, the single best skill you can practice right now is learning to trust your gut. This is your body, your baby, and your journey. So how can you tune out the noise and really, truly trust your own instincts? You got this. Thanks so much for joining us.